And obviously a perfect day to talk about sunscreen, but before we do that, do you know what is in your medicine cabinet? Here to help us take stock is Phil the Pharmacist from Hauser's Healthcare. And Phil, why is it important to know what's in your medicine cabinet and deal with your medication?
Sure. So oftentimes when we get things like antibiotics or we're switched medication, we've got these leftover bottles that can sit in our medicine cabinet, and left unchecked, they could sit there for years. So what we often remind our patients, especially when we're talking about spring cleaning and those types of things going on right now, is to also clean out your medicine cabinet of any of those old medications, because I would hate for anybody to go back and take something that's expired when it could cause them harm. So any of our 9 pharmacies across Southern Ontario will accept any medications from any pharmacy that may be expired, and you can bring those into any Hauser's pharmacy.
And why is it important to bring your old prescriptions to a pharmacy instead of just throwing them in the garbage?
When we throw things in the garbage, we don't know where they land up. Oftentimes they'll land up in landfills, and these are complicated chemicals that can cause harm to the environment. We think of pharmacists as stewards of these medications, and we're stewards for a reason, because if they got into the water supply, or if they got into animals or those types of things, they could cause some harm. Never mind if other humans were to consume medications that were not for them. So really bringing them back to a pharmacy where we can dispose of them properly is the best way to go.
And same thing with don't drop them down the drain or anything like that.
Absolutely don't drop them down the drain.
All right. Now, as Brian mentioned, today is going to be feeling like 28 degrees, high humidex, sunscreen.
Absolutely.
How important is sunscreen?
Sunscreen is so important. So, we're more prone to get sunburns when we're, under 18 or when we're over 60. Now, when we're over 60, our skin changes a little bit. It tends not to carry the same amount of moisture. It tends not to have the same kind of recovery mechanisms as we do before, so sunscreen becomes even more important. And really there are 2 major types of sunscreen that are out there. There's both a chemical sunscreen and a mineral sunscreen. And there's a lot of difference in between there, even though they both will use the same kind of SPF scale to kind of give you reference. So the chemical sunscreens, there's about 7 major molecules that we see in chemical sunscreens. The one that I usually try and avoid is called oxybenzone. And you'll find that most sunscreens are trying to remove that now. But why I really promote mineral sunscreens, which are usually zinc and titanium based, are that the mineral sunscreens tend to sit on top of your skin, so it's almost like rolling on a shirt. Now, if you think mineral sunscreens, you're going to think 1950s lifeguard, right? That white nose that's there. Well, some of those new mineral sunscreens, they actually don't have that whiteout effect kind of thing, but they can leave a pasty side to you. But the nice thing about them is that they're safer for the environment. So again, talking about drugs in the environment, these are the ones that if you were on a beach will not leach into like reefs or affect marine life or anything of the sort, where some of the chemical ones can actually cause a lot of harm. So definitely if you're on the beach, the mineral sunscreens are the way to go. There are a lot of medications that can also affect your skin sensitivity. So things like blood pressure medications, diabetic medications, we talk about anticoagulants or some kind of blood thinners or anti-inflammatories. All of these can affect your skin's ability to absorb sun. So if you're on a new medication, as a pharmacist, I would always give you that advice. But if you're not sure whether something is going to affect your skin, I would say come on into Hauser's Pharmacy. We're more than happy to talk to you about any of your medications.
All right, you got less than 30 seconds left. How important is having something like aloe around as well?
Well, hopefully if you take my advice with the sunscreen, you won't need the aloe, but aloe is a great anti-inflammatory if you do get some sunburn. So I want to mention before we go that we're celebrating our 45th anniversary at Hauser's. We'd love for everybody to come down and check out some of the deals, some of the exciting events that we're going to have. We've spent 45 years taking care of people. We'd love to take care of everybody else too.
All right, Phil, thank you very much for your time. I appreciate it. All right, good advice. Sunscreen, beautiful day. Enjoy the weather with sun care.